still once again, because it's still exactly 11 a.m. in the morning. As usual, we come back with the whole show early every Friday. It happens from Friday. Every Friday, you shouldn't miss it. Just here on YouTube Media. All you have to do is just go on our YouTube channel, Facebook, and you subscribe. When you subscribe, you won't miss out any other show. This is a whole show. We touch health matters, any health. We touch the complications, the symptoms. What are some of the things you're seeing and you don't understand? All you have to do is just send us a message. We shall always have a health expert here in the studio to at least elaborate whatever kind of sickness you're suffering from. And I'm your host of show, Brenda, bringing you Health Clinic, and I'm always joined in with Dr. Marlene Nicholas from Molago Hospital, who gave in his little time to at least share some of what he has on the health. So, Dr. Marlene, will come back on the show.
Thank you, Brenda, for hosting me again. This is the Health Clinic.
Yeah.
We do it every Friday.
Yeah.
It's an interesting show.
Very interesting.
And so many people have gained knowledge about how to prevent certain diseases. Yesterday we looked at lung diseases. So today we're also going to look at still lung diseases, but in English version. So we talked about so many different diseases. We talked about TB. We talked about pneumonia, asthma. We didn't go into deep, and other lung infections.
Okay.
So to begin with the respiratory system. The respiratory system has so many parts. Maybe the producer will help us to project, and we can see the parts of the respiratory system. We have the larynx. We talked about the trachea. The trachea dividing into two bronchi. Then we talked about the terminal bronchioles, and then even the lungs. We said that the lungs have the right lung has 3 parts, and the left lung has two parts. And the right lung has the upper lobe, and the middle lobe, and the lower lobe. And the left lung has the upper and then the lower lobe. It doesn't have the middle lobe. So the left lung is found on the left.
Yes.
The right lung is found on the right. So there are so many diseases which affect the respiratory system.
Well, that is Dr. Malay. He has opened up the topic of the day. We are touching, well, diseases of the lungs that affect the lungs. Yeah, yesterday we are still talking about the same topic, but we are using Luganda, the Luganda version. For those who understand that is a show that you shouldn't miss. If you missed it, you can just go back and you check our Facebook. We are there, and we also share the link to others. Or as we organize this show for you. For those who don't understand Luganda, you said, hey, we are all, as we all know, it's media doesn't only reach in Uganda, but we cut across borders. All you have to do is share the link for others to follow us. You just subscribe. On the show already, Dr. Mala has told you about the disease. Pneumonia.
Yes.
Okay, so but before that, what is it all about?
Lung diseases as a collective term, like it encompasses those diseases which will affect the lungs, specifically the lungs.
So that is some of that. So how can some people avoid this?
Avoid TB.
Yeah.
First of all, is to stay healthy.
Mm.
Then two, smoking is really very bad.
Okay.
Staying healthy, I mean, practice maybe health habits. Maybe keeping yourself healthy, maybe checking your blood regularly, avoiding HIVs and other things, cancers. We can stay active, like by maybe doing aerobics every day. When you do exercise, you try to increase your cardiopulmonary efficiency. So this diseases which affects the respiratory system, you try to eliminate a few. Because when you increase your exercise, you increase your cardiopulmonary efficiency, and even the immune system is strong. People who are doing exercise.
Okay.
So and another thing is to avoid congested places.
Avoid congested places.
Yes, avoid congested places. Avoid sleeping in a house whereby you are 10, someone is coughing, you don't know what is suffering.
Yes, sometimes situations lead you to such a situation, because sometimes people, you know how it is when it comes to welfare. There are those who don't have money and they find themselves sleeping in a house with like 10. There are those who even sleep like 12, even more, just in a single room.
Yes, but even you see, TB is a disease which is common in people who have low socio-economic status, and people who stay maybe in the ghettos. Yes, because now they breathe near each other. Like someone coughs, you inhale, you are near each other. There's no, because when you are in a good aeration, that organism can easily. Okay, it is not. It can easily spread in air. However, if you are near each other, when you cough, someone just inhale it directly. Okay. So that's why it is it's very good to avoid coughs.
Okay, so you're saying it's very common in those low income areas.
Yes.
But still you are telling us how when you find TB, people with HIV, they are more prone to H2.
TB and HIV,
how are they more linked to each other?
They are related to each other, because when you get HIV, your CD4 cells, which are the immune cells, which are active in the immune system, which are supposed to fight the other organs. Remember, I told you that people who are healthy without HIV, for them their immune system is a bit stronger. Their CD4 cells are high. They can easily contain these organisms, and then this person will get what you call latent TB. Latent TB is TB without symptoms. I may be having TB because I'm a doctor and I'm exposed, but I don't have symptoms. I'm having latent TB. Reason being, my immune system is still strong.
So it only arises when you contract HIV.
When you contract HIV, and maybe when your immune system becomes weak.
So other than that, you keep within.
Yeah, you die with it when you are having, because every day we get exposed to TB. Every day we are near poor coughing, and you don't know whether they are having TB. So we're having so many patients whom we tell you go back to where you stay, but make sure you put on a mask. People don't put on a mask, so they cough in the public, they cough in a taxi, they cough in the where, so you contract these organisms. But the thing, since our immune system is still strong, it will try to contain that organism.
Now, on that note, that even these people you're treating TB, how can somebody who is maybe a patient and there is somebody, a guideline helping him, that patient of TB, how can they even avoid themselves not contracting the disease from these patients?
We tell them to avoid maybe sharing stuff like maybe cups and spoons and what. We also tell them to put on a mask. Yes, to put on a mask every time when they are coughing. They should be having their mask on, especially if you are caring for a patient who is a known TB patient. You have to be really very careful. Don't share the same cup. Don't share the same these eating things. Don't share, and don't sit near each other. So we tell them to give a distance, and two is to put on a mask.
Put on a mask.
Yes, yes.
Okay.
They should be having their mask on.
Okay. That is Dr. Male telling us how we can avoid TB.
Because TB is really very infectious.
It's very infectious, yes, and it's easy to catch.
Yes.
Wow. Well, Dr. Male is telling us that if you know you're experiencing cough and you've been experiencing it for the past 2 weeks or more, and you're seeing symptoms such as losing weight, sweating at night,
sweat, yes,
all those, and also loss of appetite, you can be having TB but you don't know. All you have to do is just go to the nearest hospital so that you can be checked. We're going into a short commercial break. We're coming back still on this same topic with Dr. Mali Nicholas.
Musajja ngobi bazana emyaka mukaaga sizala
nga butazala buzazi kale kukozesa naye nga oli wakati olukumu
tunase tubeera
soga tomanyi bisambi bitereka senga
kamba njulire senga bitereka okiwanga kikutawanya ofeekera onyizaanyiza buli saawa onyiza jangu wasenga bitereka alusaazi kutawanya eddingana mu nsonga omwami tolina maanyi ga kisajja jangu wasenga bisambi bitereka ajja kutereeza ajja kuyamba abakyala bagenda kuyaayaanira abakyala ovaavaamu embuto onoonya ddagala lya luzaalo oyagala kuzaala ku mwana oyagala balongo yenna omwana gw'oyagala hormone self balansinga tolina ssanyu mu maka ago emigga gyazibikira jangu abakyala abatagenda wannakakande nyabula nnyanya agambye agenda beekolerako mu nnaku 5 zokka jangu wasenga bisambi bitereka gwamwagadde kuba ku namba z'essimu zino wammanga 0701 882 33 34 oba 0784 31 45 59 senga bisambi bitereka togenda kwejjusa.
ningeyezo msango
mukadde obadde ki gezesa ku best neighbor byakozesa
mukatkanda wangi besyamumanyi bannange akutama sapiri neganyirira ono wakunaaba wakwaza ngoye tena mu toileti ewunya akabwawa wanjikyala fenna tukozese
obulungi butandikira ku buyonjo.
Welcome back from that short commercial break. Yeah, hopefully enjoyed it. And also for those who are taking water, you took some, at least a sip of water, but you're still here on Health Clinic. We are bringing health matters, we bring you health experts, doctors, we can, anybody in matters of how we can organize or work around our health. It's all about taking care, because we all know health is really important. If you are sick, you cannot do anything. So that's why we organize this kind of show for our viewers out there. And if you know you're watching, you can also share the link for others to follow us on this same program, Health Clinic. Health Clinic is there on on Fridays, every Friday, exactly 11 a.m. here on the studios. And for those who don't understand this language, you know, anybody who says I may not understand English, you can share them the Ojakona program, which happens from Monday up to Thursday, same time 11 a.m. in the morning, with me, Nabsha Brenda, on the show. And today we are talking about the lung diseases, the diseases that happen affect the lungs. If you all know TB, if you know anemia, you say anemia? Pneumonia. I like calling it. I don't know why I confuse the two. Okay, pneumonia, asthma, that is something that we are going to be discussing later on. But before you went into a short commercial break, the doctor was still telling us some of the lung diseases. One was TB, and was telling us some of the symptoms or the prevention measures and all that. So for those who missed, you can play back and you hear the show in full. So Dr. Malik,
Yes.
as you're winding up TB and you want to go to pneumonia, what is something we should take note before we leave TB as a topic?
That people should know
Mm.
that TB is there in the community,
Mm.
and there are so many TB patients.
Mm.
And because we're having so many HIV in the patient, and these HIV patients are having TB. So
Mm.
TB is one of the opportunistic infection which affect what
Mm.
HIV patients. So if you're out there and you are HIV positive, try to avoid congested places. Try to avoid the person who is coughing.
Mm.
Yes, and another thing is to always have your mask on.
Mm.
Yes, when maybe you are near someone who is coughing. Yes.
Always have your mask on.
Yes.
So okay, that is. I think that is very
And
clear.
they not these masks. The N95 mask.
Which one? The one you cover, the ones you use in
There's one
hospital?
which filters, which can filter. Yes.
No,
But these ones they okay, they can save you, but not really.
they are not
We
the
need
one.
the N95.
Wow.
Yes. Yeah.
Okay, so that is Dr. Malay. Now, what is another disease that we should look out for?
The other disease is pneumonia.
Pneumonia.
Pneumonia is one of the disease which cause death
Mm.
among children
Mm.
and maybe in elderly.
Mm.
Pneumonia, it is very common. People have heard about pneumonia. People have heard about people who have died, children who have died of pneumonia.
Mm.
So pneumonia, it's really it's a lung infection, and it is caused by microorganisms. We have so many microorganisms. The other time you were asking me, but you keep on talking about microorganisms. There are so many.
Mm.
Even here on the table, we can't see them, but they are there.
They are everywhere.
They are everywhere.
Mm.
So these microorganisms, when they enter our respiratory system, then they cause an infection, and then you develop what we call pneumonia.
Okay.
So pneumonia, the reason why it is common in the children is because their immune system is still developing, and even the elderly having their immune system. The immune system is suppressed.
Mm.
People who are of age above 65, that's why they die of pneumonia, and maybe the children. So pneumonia, how would you know that maybe your child is having pneumonia? This is like some of the symptoms of pneumonia. If a child is coughing and at the same time is having fever, that's pneumonia. Cough and fever.
Cough and fever.
That's pneumonia. So if a child is having these other bad signs which I'm going to talk about, like maybe difficulty in breathing, child maybe grunting. Grunting, I mean someone is grasping, like grasping for air. Like a child who is having difficulty in breathing, a child who is having when you export the chest and you see there's chest indrawing and maybe intercostal recession. Those are really bad signs that maybe the child is having what? Severe pneumonia. So sometimes if you check the mouth and maybe the fingertips, they can be bluish in color. Actually, we call it cyanosis. That is severe what? Severe pneumonia.
Severe.
So pneumonia we're having pneumonia, and severe pneumonia. So no pneumonia, someone can be having just maybe is having cough. Yeah? So that's not pneumonia. If someone is
That
having
is not pneumonia.
if someone is having maybe cough with difficulty in breathing, that one can be what? Pneumonia. If someone is having maybe those cough and difficulty breathing plus the signs of respiratory distress, like maybe grunting, intercostal recession, and fever, so that is what we call severe pneumonia. Severe pneumonia is really very dangerous, and it's #1 leading cause of death among children. Yes.
Okay. So that is if somebody, because you are telling us how does somebody contract this pneumonia?
Because now, when they are near people who are coughing, they get those organisms. Even those organs can spread in blood. Yes.
Yesterday you're telling us focusing on the baby, especially babies, they contract.
Babies can contract as they are passing down through the birth the birth canal, so they contract those organisms. Especially now in the neonates, people, those neonates, I mean a newborn who is just below 1 month can contract that organism, and then maybe later that organism can cause what? Pneumonia. However, the newborn won't cough, but will be having signs of sepsis, jaundice, will be having fevers, So for a newborn, they won't cough. Don't wait for cough. However, when you see that maybe your child is having high temperatures, is hot, you take that child to the hospital, maybe having maybe pneumonia.
Okay.
Yes.
Wow, that is really interesting. So if you're looking, you have also mentioned the symptoms.
The symptom really cough and fever.
Cough and
Fever, I mean when you press your hand, you can feel that the child is hot, and the child sometimes the child is coughing, and maybe the breathing, the child is breathing so fast, the heart rate is so fast, so just know that the child is having pneumonia.
Okay.
Yes.
So and even you told us, like, if you see a child breathing and you see the lower chest is
yes, there's indrawing. There's indrawing, lower chest indrawing, and maybe even in the ribs here there's intercostal recession. You see indrawing, things moving down as the child is breathing. Just know that the child is having worst signs of what? Of pneumonia. So take this child to the hospital. Don't try to give a herbal medication. No, our parents like to try, like giving herbal, but herbal won't help when the child is having severe pneumonia. Yes.
Okay. So that is Dr. Ma. But now, as you're winding up, because time has left us, what is the treatment you give to these patients who are contracting pneumonia, and how can somebody prevent it from or avoid contracting it?
The treatment it depends on the presentation. If it is severe pneumonia, we put this patient on oxygen. We give them supportive and then maybe definitive. Put them on oxygen to support the oxygen saturation. And two, we give them a definitive one. We give them antibiotics. Yes, we put a cannula and then we inject you with what? Antibiotics. With the pneumonia, without a severe symptom, we can give you oral medication, oral antibiotics, and then we discharge you and you go home. However, with the severe pneumonia, when the child is having those signs of respiratory distress, we add in it, and then we give what? Parental medication via a cannula.
Via a cannula.
Yes.
Okay. Wow, that is really interesting. Well, our time is leaving, but doctor, as you're winding up, because I understand we have more lung diseases that you have not
There are so many lung diseases.
Like
asthma we have in cancer, and maybe I'll talk a bit
Which
about
cancer?
Lung cancer.
Okay, lung cancer.
Yes,
Okay.
because lung cancer is common here in Uganda, and it's one of the leading cause of death. It's also it tops among the cancers which cause death in our patients here in Africa, and maybe especially the sub-Saharan region. I don't know why so many diseases are so common in the sub-Saharan region. I don't know what we did, but so many diseases are common in the sub-Saharan region. There are those cancers, but even in other countries, lung cancer is common. So lung cancer has so many risk factors. Especially the first one is alcohol. No, smoking. Then this alcohol come in. But smoking, cigarette smoking, actually it's one of the leading cause of what? Lung cancer. Smoking. If you have ever smoked and you are coughing, you see coughing, you are coughing blood, you just get worried that maybe I'm having what? Lung cancer. And lung cancer, you cough, that cough be having blood, sometimes be having blood. Another thing, you'll be having fluid within your what? Doctor will tell you that, hey, you're having what? A fluid within the lungs. That's what we call a pleural effusion. So lung cancer normally causes that, pleural effusion. Even TB can cause you to have a pleural what? A pleural effusion, I mean fluid within the what? Within the lungs. So lung cancer is also common, people should know about it. And how to avoid it, exercise, and to avoid smoking.
Avoid smoking.
Avoid smoking. Okay. Avoid smoking, especially cigarette smoking, is really dangerous. That's why on those packets they put those people who are manufacturers of these cigarettes. They put see what is very risky to smoke.
They put it, but still they insist. It's really so interesting, but and when you look at it, somebody reads it, but they still continue. They smoke.
I don't know even what is in the tobacco there, which they don't know what's the. I don't know how it feels when people smoke.
Well, if you ask some of them, they will say they feel they can. There are those who are addicted to it. Actually, they feel they cannot leave it. There are those who say I can't do anything. I don't think
it is nice. I don't think it tastes nice.
You don't think it tastes nice?
Maybe this shisha you can feel. Maybe there's that odor which is the smell. But
well, the nice scent because it comes into scents.
But the cigarette smoke, I don't think that is nice.
It's not nice.
Actually, smoking is two types. You maybe you may be an active smoker and a passive.
Yeah, passive
You
one.
may be, if you are near someone who is taking a cigarette, you are also smoking. So that's why it's better to avoid people who are smoking and maybe keep a distance.
Okay.
Yes.
Wow, that is really interesting. Our time has gone, but as you're winding up, Dr. Male, we'd like to appreciate our viewers who have been watching us from to away from 11 a.m. in the morning when we are taking you through this.
Maybe Brenda, we still have some few minutes. We can talk about maybe asthma.
Asthma.
A few maybe symptoms.
Oh, they're telling me my time is really up. They are waiting. Maybe that we can keep that for the next time, because that is also something that can draw them to keep on and be waiting for this particular show, health clinic. Yeah, we shall definitely come back with Dr. Male to talk about some of those heart diseases that we just left out due to the matters of time. But well, it has been me, I'm sure, Brenda, together with Dr. Male Nicholas from Mulago Hospital. You can just say out something. The last remarks.
I just want to thank Youth Media for these programs, because they are helping the community and they still the people at large. And this program, the aim of this program is to give our viewers as much knowledge as we can, because where there is no doctor, you can be a doctor yourself. Yes, you don't have, sometimes you don't have to go to the hospital.
Okay.
So where there is no doctor, you can be a doctor yourself.
You can be a doctor yourself, but he's not telling you to medicate yourself. No, at least you should get some health tips or some health knowledge from the health experts themselves. That's why, as Youth Media organized this particular show, because we all know health is really critical and very important. We do whatever we do because we're healthy. Yeah, you may be sick, but still you're undergoing some particular treatment, and that is why sometimes before you get to that particular sickness, what are some of those things that you need to take note to avoid it? Because sometimes we fall sick, but because of our carelessness, we lack this kind of knowledge.
Yeah, actually we are captives of our own negativities.
We are captives of our negativities. So that is Dr. Male Nicholas telling you that. See you next time. It will be Friday, 11 a.m. in the morning, when we bring you back Health Clinic on this same show or station, Youth Media. You just go.
People can drop in their questions. We're having our new WhatsApp group. People can send us questions. If you are taking an unknown medication, if the doctors gave you and you need explanation, you can send for us. Ask questions. So make this thing interesting.
Yeah, they should make. You only have, if you in case, because sometimes I even talk about mostly parents. You know, when you have a child, you have a newborn, but the child falls sick, you start panicking. You don't know what to do. You're calling, your doctor is not picking. You're calling.
We have given them tips that if you're having a child with fever and cough, that's pneumonia. You can't do anything at all.
And now they have a change for the WhatsApp group. Unless if you share any comment or you're asking any question, definitely our doctor will be responding to you on that. Yeah. See you next time. Just stay tuned, because there are more upcoming interesting shows that you shouldn't miss on here on Youth Media.